Welcome to Seniors Alive. This program features people who work with seniors to have a healthy, positive later life, and also it features people who are seniors who are positively aging. Today we have with us two guests who are working with seniors in order that they might have a more successful later life. Barbara Larson of Elder Care Providers Coalition, and Renee Chevreau, who is with Sierra Nevada Home Care and is chair of the upcoming event, May 21st, which is what we're going to be talking about today in part. May 21st, Holiday Inn Express here in Grass Valley. So everybody stay tuned for more information on that. So welcome to both of you. Thanks so much for coming.
Thank you, Judith.
So the event I just mentioned, which is called Aging in a New Age, is a project of the Elder Care Providers Coalition, of which we are all members. And I remember when we started talking about this a year ago, so it's really had a long planning phase, and that's partly due to the many interesting speakers who are coming. But let's talk for a minute about Elder Care Providers Coalition and what it is. And Barbara, I know you've been in on the ground floor.
Yes, the Elder Care Providers Coalition started in around 1991, and there was a small group of us who just felt that we needed to network, come together as healthcare professionals, that we too were caregivers, professional caregivers, and to support one another, and also to bring awareness and consciousness regarding elder care issues. So we started in 1991, as I just said, and we've been going ever since. I have been the chair for 20 years, I guess, now.
That's right, it's 2011, not 20 years.
Yes,
my.
Long time. So, yeah, and basically we covered the spectrum of elder care as far as professionals in Nevada County. We have about 62 members.
Is that how many we have now?
Mm-hmm.
Wow. Mm-hmm. And you know, I didn't put this on the screen, but what is our website?
The website is Elder Care Providers, with an S, coalition.org.
Yeah, so our whole name spelled out, eldercareproviderscoalition.org.
Yes.
And on that, what might people find on that website?
Well, one thing that people will find is our claim to fame is our guide, our Guide to Elder Care Resources and Services, which is a free guide. And they can download the guide if they want, or just look at different services that are provided through the guide, and the services that are free of charge as well as those that require a fee. And so that's one of the main things. The other is any upcoming events or issues that we are dealing with will be on the website as well.
And we might just talk a minute about what an Elder Care Providers Coalition meeting looks like, you know, when it is, and what happens there.
We meet the second Wednesday of every month from 12 noon till 1:30 at the Sierra Nevada Home Care Conference Room. And basically what we do is we just go round table. It's somewhat informal. And each agency or individual in a business will talk about, you know, what's up for them. You know, if there's an upcoming issue that we need to be zeroing in on as a group, if there's some legislation that we need to be taking care of, if there is if any of the particular agencies or individuals are going to be doing any fundraising of any sort, we just share it with each other. And I think what's so wonderful about the coalition is that when one particular issue comes up, that we feel that our county supervisors need to know about it, then they listen. Because the coalition, as I said, represents the spectrum of elder care here in the county.
Yeah, and we really do have just, you know, at least one of almost everything you could possibly have people who deal with finances and fiduciaries and representatives from assisted livings and independent livings
And hospice of the foothills.
elder
and
law.
Elder law, all the different issues.
Yeah, plus the kinds of things that we do. So let's just talk for a minute with Renee so that it's not just all, we've sort of said we would divvy up the business of the day in a certain way, but I just want to say, speaking of the kinds of people involved in ECPC, Renee, you're a medical social worker, right? And what do you do at Sierra Nevada Home Care?
Home Care is an agency that is a licensed agency that visits patients in their home or referred by physicians. So we have registered nurses, physical, occupational, and speech therapists, and then 2 medical social workers. And so our job is to go assist them in whatever clinical way we can to improve their physical and functional status.
Mm-hmm.
And my job is to help with resources and services and make sure they have whatever they need to remain in their home, or if they desire to move, help them with the options out there, those kinds of things.
So you actually do a little bit of placement work yourselves?
I don't place, I educate about what the options are. If they need me to make calls on their behalf or get information, I will. I often work with family members of the patients to help them access whatever resources they need, particularly with placement.
And people that use your services are people that have just been in the hospital, or do they get to Sierra Nevada Home Care even just fresh off the street?
Our patients are always the result of a doctor ordering our services, because primarily we're reimbursed by insurance and medical and Medicare primarily.
Okay.
But they don't necessarily have to be hospitalized. Sometimes there's health events and the patient isn't in the hospital and the doctor can still ask us to see them in their home.
Yeah. Okay, good. So that gives us a feel. And our listening audience is quite aware of your background, if they, unless they just started watching the program, because we had a good interview with you last couple of months ago. It will be by the time this program's airing. No, last month, that's right. It's very hard operating in real time here. About your movement with meaning work. Yes. So inspiring.
Thank you.
Okay, so what do you think is important for people to know about ECPC, Barbara?
Oh, I think it's important, especially for healthcare professionals who feel like that they're working in a vacuum by themselves, and they want to find kindred spirits, so to speak, and just know what the other resources are in the community. I think it's so important that, as Renee does with her work and I do with mine, that we work in collaboration with each other, and that we're not in isolation. And so many times when I get a phone call from a healthcare professional of some sort, they're not aware of what the resources are for their particular client or whatever. And it's important to know that, because we want to make sure that there is sort of like a wraparound program, so to speak, for the elders and their family members, so they know, who to call. And like the upcoming Yes I Can series is coming. It's important for people to know that.
It's not April yet, is it? April 4th, but it will be April by the time this program airs. But I've always had that beginning date for the Yes I Can series. Do you know if there's still openings in that, Barbara?
You'll have to call Evelyn to find out.
Okay, and that's at the Sierra Nevada Home Care number that's been on the screen. Well, let's talk a little bit about this exciting event that's coming up. So, Renee, why don't you fill us in a bit about it, and maybe they can put the flyer on the screen while you're speaking.
Okay. So this event is entitled Aging in a New Age, and we as a group and Elder Care Provider Coalition decided to do an educational conference because we don't have many available to us. We used to when we had Del Oro very active in our community. Even the Alzheimer's Association would help sponsor educational events, but they're far and few between now. And we did one 5 years ago, it was very successful. 5 years have gone by, and we decided to do another one. And the focus of this is really successful aging and trying to dispel the stereotype that aging is really a negative experience, and also how to maintain health and function and mental status as we get older. So that's the main focus of this conference.
So give us the logistics, place,
Okay.
time, cost, if any,
Okay.
lunch, that type of thing.
It's Saturday, May 21st. It's from 9 to 3 p.m. It's at the Holiday Express Conference Room. Wonderful venue to have this conference right in Grass Valley. It is a $10 contribution or donation. Anybody is welcome to come. The contribution is really just to help cover the expenses of the conference. There will be a light breakfast and a very nice lunch offered by one of our assisted care facilities. There will be a total of 6 speakers. Two, I call them 2 main speakers, but 2 speakers in the morning, and then 4 speakers later in the day. There'll be events. There'll be little giveaways. It's just going to be really a full day.
Sounds like it. And this $10 donation is actually covering lunch too, isn't it?
Yes,
Yeah.
it covers
So
everything.
that's really great. I mean, so tell us about the speakers.
The 2 speakers in the morning are Dr. Barbara Glogly. She's the chair and professor at American River College in the field of gerontology. Her doctorate is in human development, and her master's is in psychology. She's just an amazing woman, an example of successful aging herself. Has taught in that field for over 20 years now. Very well known in the community and even in the state. And her focus will be looking at kind of how aging has changed over the years, how we look at aging. Second speaker will be Dr. Mungus, who also he has a doctorate in psychology. He's a practicing psychologist at UC Davis. He teaches, and he's involved in research down there at the UC Davis Alzheimer's Center. And his focus will be on healthy brain aging. So those will be the 2 main speakers. And then, do you want me to continue with the...
Yeah, so that's the morning.
That's
Right.
the morning.
Okay, so
And-
then after lunch, and I suppose there will be a little time for people to socialize and stretch and get some fresh air.
Absolutely. And in between these 2 main speakers, we're having Sarah Heinzel, who's a registered nurse and a senior certified
Trainer.
trainer. I was going to say exercise person. In between the 2 main speakers. So she'll make us do a little
Oh,
movement,
good.
probably. And then in the afternoon, we have Catherine O'Day, who is a speech therapist, actually, with my agency. Wonderful woman who's going to talk about proper nutrition. And then we'll have Barbara Larson and Melissa Horton, who will also discuss ways to improve brain function and visual and auditory sequential memory.
Wow.
Barbara doesn't do anything simple. So it will be
Can hardly
just
pronounce that.
wonderful.
Yeah, that's
Well,
great.
yeah, just because people say, what's visual and auditory sequential memory? This is where we're going to actually be doing particular exercises that help with the plasticity of the brain, and how, exercises that have been proven to work in keeping us mentally and physically alert.
And are they the movement with meaning kinds of things that you showed us last time?
Some of the things, but it's going to be a little bit more specific with the neuromapping that Melissa is going to be presenting.
I see. Okay, good. And so that is the day then?
So that's the day.
Yeah.
And interspersed in that, we'll have lunch. We will have raffles. we've had the luxury of having a lot of donations given by assisted care facilities, attendant care services, county, private private folks in business and nonprofits. So we have lots of items to share with
How fun.
participants.
Are you still looking for raffle items?
I think if we have more, we'll run out of time and we won't have the speakers.
We have so many.
I think we're doing fine.
Uh-huh.
Yeah.
Doing fine. And we'll have an information table as
Yes,
well.
a resource
A
table.
resource table that will have so many resources for people in the community to peruse and look and browse and see what's pertinent for them
And to take home.
and to take home.
And the materials on the table will be from ECPC members?
Yes, exactly.
Yeah, great.
Yeah.
Now, do you think there will be any other events like this in the future? I mean, this has taken a lot of work. Do you feel like maybe in 5 years?
I think, the committee, we've actually had that discussion because we thought about trying to create an annual conference. I think right now, and I think it's more realistic to do this every 2 years because of the volunteer time and because of the resources that are donated to us. Because we're a very small organization, we have a very tiny budget. We're not even an organization, we're just a collaboration of folks. And so I'm depending on the generous contributions of many agencies and people, and I don't want to take advantage of that.
Yeah, I really agree with you as a member of the coalition, and I know how much time and energy has been put into this, especially by the subcommittee. And I think we all need a breather from it, and like you say, the people that donate the resources and so on, it makes a lot of sense to me. There's some other event in the Bay Area that occurs only every other year, and I've been racking my brain to think about what it is. This program, as you probably know, also airs in Palo Alto. I send a DVD down there. It used to be the other way around. We taped shows at Palo Alto Media Center and shipped them up here for the years I was commuting, but now they occur in the Bay Area, and I'm aware that this is very specific to our area, so it might be of some limited interest to the people watching from the Bay Area, but there are similar programs going on. One of them is being operated out of Avenidas, Palo Alto Senior Center, and it is under the leadership of a woman named Chris Kennedy. So if anybody in the Bay Area is interested in learning more about what's going on, give Avenidas a call and find out about the aging-friendly community work that Chris Kennedy is doing. I was involved in that group when I was in the Bay Area, the preliminary planning phase of it, and I know the people that are involved in it are just the same wonderful kind of people that we have up here in Nevada County. I must say, I'm so glad I'm not commuting all the time between the two. It's nice to be settled down.
Yes.
Well, some, adult children may have their parents here.
Yes, absolutely.
In this community.
And so let's talk about target audience for the conference. Who's welcome to come?
Anybody in Nevada County is welcome to come. It is about successful aging, and as we all know, we start aging from the minute we're born. So, but I think more specifically, older adults, family members, particularly baby boomers, I think, will probably be a large population of the participants. But anybody's well. My children are coming. They're in their early 30s. I mean,
Great.
They're interested. So we have 160 available seats at tables. We'll have a few more seats not at tables, but I imagine it will fill rather quickly.
Yes.
So it's I would recommend if anybody's interested, they call in.
And call helpline.
They call helpline.
Which the number there? I know it's been on the screen off and on,
And
but
this is where I have to put my glasses. It's 273-2273. And you just call them and you tell them you would like to register for Aging in a New Age and give them your name and phone number, and that's all that's required.
yeah,
And if you need any special accommodations in any way.
which would be like what, for example?
If you had adaptive equipment, we needed to
Okay.
have special accommodations for. If you had hearing or vision deficits, maybe we need to accommodate that.
So we can accommodate that, though,
We
up to
can.
a certain extent, I
Right.
suppose.
Right.
Yeah. Well, I'm aware that many seniors watch this program on Channel 11, and I'm really hoping that they will consider coming as well.
Absolutely.
But we definitely need to emphasize that the spaces are probably going to get filled up fairly fast.
I agree.
And how, besides this TV program, are you going to be advertising it?
We'll be doing some radio interviews. We will be doing some locally and down in Auburn. We will probably have some some announcements in the newspaper.
I think there's going to be an article in the newspaper, probably with the Healthy Tuesdays edition.
Yeah,
And
good.
there will be flyers
That
all
will be-
around the community.
Uh-huh. So the flyer we've been showing on the screen will be kind of available in lots of places,
Right.
like the RSVP office.
Correct.
And adult services.
And it is available on our website also.
Okay, great. So in addition to the resource guide on the website, we have the flyer for the conference.
Yes.
Correct.
That's great. Yeah. Boy, it's nice having that website, isn't it?
It's wonderful.
Makes it, trying to get these guides around. And we should put a plug in, though, for 211, dialing 211. I know Terry Boyer is trying always to get those brochures and cards out, and that's a wonderful new service that we have to, if people have any questions about resources for any area in the United States. It's a United Way project, and I'm so glad that we have that implemented now, too. So we have a lot of resources in our community that seniors and their adult children can draw on. What do you think the major challenges are facing us here in Nevada County with our large proportion of seniors?
Oh, boy. Well, transportation has always been a problem, and I think it's continuing to be a problem for some seniors, especially if you live out, in the boonies, so to speak. And we've been facing issues around transportation lately, it seems like.
Uh-huh.
I also think, I think respite care. We have a wonderful adult daycare down in Penn Valley, but because of its location, even though Telecare will provide transportation, it's still problematic for some people to get there if you live out further at the Ridge or, down towards South County. So that's a transportation issue, but it's also we don't have respite opportunities for caregivers. And when Delaware Caregiver Resource Center was very active up here, there were funds and much more availability of respite for caregivers, and there really isn't too much available right now. So and as budgets become tighter on the state level, they become tighter on the community level, and those things make it much, much harder for caregivers, particularly.
The Helping Hands in Penn Valley isn't even open every day, is it?
No, 3 days a week.
Mondays, Tuesdays, and Fridays.
Yeah. And
Yeah.
it's wonderful. Wonderful.
I have a client that's going there now, and he just loves it.
Oh, that's so good. Yes, I know it is wonderful, and I've got to get Chris Holland on this
Yes.
program soon to tell us more about it. I'm just wondering, with the cuts in services, if you see the need for more volunteers to work in this area, and just thinking ahead, how do you think volunteers to do respite care might be channeled into to doing that kind of work? What do you see ahead with budget cuts? and volunteers.
I think it's very hard when we're dealing with volunteers in respite, because you want to make sure that the person is trained properly, and not be put in a situation in which they, they don't understand, they don't have the experience, and know the resources as well. I know that when I was the first program director of the adult social daycare program in 1988, most of the people were volunteers. But that was more a contained environment in which I could train them, or they could get a training for understanding the population that we were dealing with. But I think it was a few years ago, wasn't it, Renee, that we did a presentation at the Methodist Church and talking about how to the ministry that goes into the homes and that kind of a thing, and some of the red flags, so to speak, about having volunteers go into the home and what to do and that kind of thing. So it's a delicate issue, I think, because my mantra is training. You can't get enough training.
Yeah. Well, of course, one of my long-term interests has been in training church people, lay people, to go visit in homes. I mean, I've been doing that since I worked in Los Altos in the mid-90s, doing friendly visitor training, congregational caregiving. But that has all been around visiting people, who don't have dementia or really serious dementia. And it hasn't been so much around respite care or supporting caregivers. But I'm sort of thinking a little bit out of the box here with you, just because you have such a great perspective on this, and thinking about our county and the needs in our county. I'm just, I'm thinking actually that it's something that ECPC maybe could talk about a bit, to think about what are we going to do to do more training of potential volunteers, and trying to work it through the churches maybe. I don't know. I'm just brainstorming.
Right.
Because of talking with Teresa Haleen recently about the huge problem we have with senior housing, senior affordable housing. And so I have brainstormed my little way to almost the end of our show here. And I want to thank you. We want to emphasize to our listening audience that you need to call the helpline,
2273.
Yeah, I ought to be able to remember that that number, to reserve your space at this really hot event that's coming up with wonderful speakers and a wonderful lunch and activity and all sorts of. Honestly, I am so sorry that I am going to be on vacation in Greece.
I know. That's terrible.